Welcome to British Biomedicine Institute. Today we will explore contrast techniques of gastrointestinal tract, biliary tract, genito-urinary tract in radiodiagnosis. X-ray and other imaging contrast studies visualize the entire gastrointestinal tract from pharynx to rectum, and are most useful for detecting mass lesions and structural abnormalities. Barium sulfate is almost totally inert within the GI tract, having little physiological effect, other than responses to volume and fluidity. Barium enema is an examination of the colon to assess a change in bowel habits, abdominal pain, rectal bleeding, diverticulitis or suspected masses. Barium enema with air contrast may be used to examine the colon to assess symptoms, including a recent change in bowel habits, abdominal pain or rectal bleeding. Compared to a barium enema, the air contrast examination offers increased sensitivity for the detection of polyps and small masses. Upper GI tract study uses a special form of X-ray, fluoroscopy, and an orally ingested contrast material, usually barium sulfate, to examine the pharynx, esophagus, stomach and duodenum. An upper GI examination helps in the detection of abnormalities of the esophagus, stomach and duodenum, including ulcers, scarring, tumors, blockages, hiatal hernia, reflux or inflammation. The procedure is also used to help diagnose symptoms including difficult or painful swallowing, severe indigestion, chest and abdominal pain, blood in stool or unexplained vomiting. Capsule endoscopy is another developing imaging modality used to examine the GI tract. It is highly sensitive but has a lower specificity, and there is also the risk of capsule retention. Biliary contrast agents can be taken orally, for example calcium iodide or intravenous megluminal hydroxide. The contrast media are excreted by the liver and concentrate in the gallbladder after passing the intrahepatic biliary 3 and cystic duct. Urography uses imaging and contrast material to evaluate or detect blood in urine, kidney or bladder stones, and cancer in the urinary tract. Urography with conventional X-ray is known as intravenous pyelogram, IVP. Urography is also often performed using computed tomography, CT, or magnetic resonance imaging, MRA. CT and MRI urography are painless and proven effective in detecting urinary tract issues. Thank you for showing interest in British Biomedicine Institute Skilled Nano-Degree Program. Hope you have gained a lot of clinical information through this presentation. Please share, like, and subscribe British Biomedicine Institute channel. Good luck.